So today we're going to be talking or taking a look at the new COVID-19 vaccines that are available in Ontario. I'm going to be addressing just very, I don't say basic, but a general understanding of the vaccines that are being used. We're going to talk a little bit about how they work. We're also going to talk about their availability for this year as well. So without further ado, I will start. So our objective today is to understand what is COVID-19. Just a very quick overview. I'm not going to take too much of your time on that. We've been dealing with this for the last 3 years, and I'm sure everyone has been inundated with a lot of information on what COVID-19 is. We're going to talk what are the vaccines, or are the vaccines safe? We're going to talk about the approved vaccines in Canada, which is that's the meat of the presentation. Talk about how they work, and then I'm going to get into some regional updates and questions and answers. Q&A. Our presentation today will not be too long. I'm hoping to be about half an hour to 45 minutes. And at the end, feel free to ask as many questions as you want. If anyone has a question, by all means, raise your hands as well, and I will answer to the best of my ability. So what is known about COVID? COVID can result in a range of illnesses from mild symptoms to severe illnesses and death. And as we've known over the last 3 years, there's been an increase in ICUs and in deaths at the beginning of the onset of the outbreak. But as of lately, based on vaccine and other control measures, the death rate has declined. ICU visits have diminished or declined as well. And COVID now is more or less a virus that causes, could be mild to severe symptoms still, but based on us having vaccine, it has caused the amount of deaths to decline substantially over the last little while. We are going in outbreak season again, our cold and flu season. So once again, COVID vaccine should be pushed as one of the major ways of preventing the spread and also keeping our clients and our patients and residents safe as well as staff. So spreads mainly person to person through respiratory droplets. There has been some indication that it could be airborne as well. Close contact, which is closer than 6 feet or more than 50 minutes or longer, cumulative over a 24-hour time period, it is what we consider close contact. If you're over around somebody who is positive for COVID within 6 feet, there's always a slight possibility that you can become infected if you're around them for greater than 15 minutes without any control measures. So when I talk about control measures, no masks on both ends, the person with it and yourself. We don't know how COVID affects each person, and that is the major reason why we really push and advertise the COVID vaccine. Some people, such as adults 65 years and older, with certain medical conditions, are more likely than others to become severely ill. And again, having us dealing with this over the last 3 years, we definitely see that as well. Some of the symptoms, again, this is just repetitive for a lot of us because we've been doing this for 3 years. Fevers and chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, headaches, sore throat, congestion, nausea, diarrhea, loss of taste or smell. I myself had COVID about 2 weeks ago, which was really bad, and I did have all those same symptoms. I had the fevers, the chill. I had a fever of about 39.5 degrees Celsius, cough, which lingered up until I still get it in the evenings, shortness of breath, which I did have, fatigue, muscle aches, headaches, sore throat, congestion. All those are symptoms I had as well. So again, these are some of the predominant symptoms for COVID when someone is positive. There are cases where people are asymptomatic as well sometimes, meaning that they are positive but present no symptoms whatsoever. And we do see that too as well. Also be alert if a person has problems breathing, persistent pain and pressure in the chest, new confusion, inability to wake or stay awake, and bluish lips. Definitely that is an emergency occurring, and 911 should be called. That person should be admitted or sent to an ER or hospital, nearest hospital as well. How do vaccines work, and what makes the COVID-19 vaccine safe? So pretty much vaccines help people develop immunity to virus or other germs. The body's immune system develops antibodies to the specific virus, which are the antigens on the virus. The body sees these virus again, it will remember how to make the antibodies, and the person will likely not get sick or will help to prevent ICU. Oh, so a person will not get sick And again, with vaccine will help to prevent ICU visits or even deaths. So again, with the vaccine, this is very general. It develops some form of immune response. That immune response is antibodies. So what happens later on down the road, if you are actually infected with COVID, your body responds to the antigens. It says, hey, there's something foreign in my body. Oh, I remember what that is. I made antibodies for that. Antibodies go off it and they help to prevent illness, or they help to prevent the severity of illness, which usually causes death as well. So again, the vaccine does work, and it does help to reduce the amount of ICU visits and also the amount of deaths as well. Vital to keep you and your family and your community healthy and safe. So any community where people are vaccinated or heavily vaccinated, we do, I mean, as a public health person or public health investigator, I do see this, be it anecdotal areas or communities where people are heavily vaccinated for a specific disease. Those diseases tend not to occur in those communities. So because we have such a great uptake in terms of vaccine in Canada, the number of deaths may not be as high as they would be in maybe a developing nation where vaccine isn't accessible as well. Vaccines used in Canada are safe and were tested in clinical studies. Studies involves tens of thousands of people. Again, these participants usually differ in ages, races, and ethnicity to get a proper understanding of whether or not the vaccine works. There's always a safety board that approves every study, which Health Canada did have as well. And Health Canada carefully reviews the data from every phase of every vaccine trial to determine its efficacy and determine its safety as well. And with vaccine, I mean, it's only been 3 years in, and data collection continues to ensure the long-term effects are safe. So they're still doing data, still doing studies to determine whether or not the vaccine is safe as well. COVID-19 vaccines approved in Canada. So we do have multiple vaccines that are approved in Canada. I just put the three that are on the Health Canada website, which I've dealt with in the past. The two big ones, which you will more than likely see all the time when you go to your clinics, are going to be Pfizer, BioNTech, Moderna Spikevax, which are both mRNA vaccines. And then we also have a Novavax, sorry, I apologize for that tongue twister, which is also being used as well, but in other provinces and other areas. This is a protein subunit-based vaccine. So it uses the old measures, the old vaccine methodology, and producing COVID vaccine based on this vaccine as well. So this vaccine uses the old method to be produced, whereas Moderna, Spikevax, and Pfizer uses mRNA, which makes it easier to produce, more efficient, and maybe slightly more effective as well. But we'll get into that as we get into this presentation. So again, these vaccines are different types of vaccines that are available in Ontario are mRNA vaccines. We do have viral vector-based vaccines, which I don't think is being used anymore, which was AstraZeneca. I believe that was pulled with Janssen & Janssen as well. We also have protein subunit vaccines, which was Novavax, which I showed you, and the plant-based vaccines as well, which is a new form of vaccine that we're using for COVID protection. mRNA vaccines. So in a quick nutshell, I'm not going to get into the science of this with mRNA vaccines, but it pretty much is a vaccine teaches the body to build a protein that is found on a virus that causes COVID-19. Your body sees this protein that doesn't belong, and in turn, your body builds an antibody to fight the COVID-19 virus. There's no viral particles injected into your body with these mRNA vaccines. And the mRNA vaccine, the mRNA and the vaccine cannot affect your DNA in any way as well. So what it does is it produces these false antigens or these responses or these proteins which produce an immune response. These are not proteins that can cause infection or antigens that can cause infection. These are mimics. And then your body notices this, formulates an antibody response, and now you have antibodies and some form of protection against COVID. Very general, very easy. The best thing with this mRNA vaccine is they've been able to use it for other vaccines to fight cancers. And this is something that isn't brand new. We've been dealing with mRNA vaccine for decades. Since the first SARS, back in 2003, and the age of myself, that's when I was about 3 years in to infection prevention and control or infection control. Um, they've been studying and producing and looking at making vaccines based on mRNA. So this is not that new whatsoever. Very efficient, very effective, and the positive about it is it is easy to and quickly you can create vaccines and make vaccines based on this form of a methodology for producing vaccines. Very good and very easy and effective as well. So just a brief synopsis of how it happens and how it works. I won't get into it again into the science per se, but once the mRNA gets in and produces those proteins or antigens or those protein receptors, what happens is your body again sees these antigens which are foreign to the body and creates antibodies for this, and hence we have protection for COVID. So let's talk about the vaccines that are mostly used in Ontario. And the mostly used ones are going to be the Pfizer BioNTech X-ray Bravo Bravo vaccine, which is for X-ray Bravo Bravo 1.1.5, which is one of the prevalent strains that we are seeing in terms of COVID. But there are other strains that we are noticing that are going to be more prevalent than this one, from our understanding. But because they come off of the same lineage, there has been studies to show that there still is protection as well. So the Pfizer vaccine is 95% effective for prevention and severe outcomes. This vaccine now, because it is mRNA, updates over time to target new variants. So as I mentioned earlier on, with the mRNA vaccine, with this methodology for creating the vaccine, it makes it very easy for the vaccine for these companies or for pharmaceutical companies to be able to say, hey, okay, this is a prevalent strain. Maybe we should use this antigen, or maybe we should create a vaccine for this specific strain. And based on what we've been seeing in the community, there will be protection with Pfizer and Moderna for the new strains that we've been noticing that are prevalent, or going to be the prevalent strains this coming cold and flu season. So back in 2020, it was created to target original virus. So back in 2020, we created this new mRNA vaccine. It was targeting the original virus. Then in 2022, we had to create a bivalent, which targeted the original virus and that new Omicron variant. As we all know, back in the time when the Omicron hit, it was very vicious, and it was very prevalent in our communities. So they came with a bivalent vaccine, which targeted both the original virus and the Omicron variant, which did work. But now we have a new monovalent vaccine, which targets just the X-ray Bravo Bravo lineage, which is, again, as I stated, the variant of, not variant of concern, but the variant that will be most prevalent come this year's cold and flu season. Again, mRNA uses a messenger RNA to produce in the vaccine, which creates a immune response as well. This vaccine is also stored in a freezer level thermometer temperature. Stored in freezer level temperatures, kind of like Moderna. And shots may be administered and updated yearly, like the flu shot. So every year with influenza A and B, they go through genetic shifts and genetic drifts. Genetic shift would be more prevalent, make things much worse. Genetic drifts aren't as bad as genetic shifts, but we do have different strains of influenza A and B. As they fluctuate and flow throughout the rest of the world or the regions, we follow them. World Health Organization, CDC, even Health Canada, local health units, and we have understanding what's going to be the prevalent strain. Pharmaceutical companies are also following these, and kind of like influenza A and B, it looks as though we're going to have yearly shots or yearly boosters come flu and cold season, which is based on the prevalent strains that we're noticing out there in regards to COVID. We do it for influenza A and B. And I don't see why we can't do it for COVID as well. We're now using mRNA methodologies, which is making it easier to produce the vaccine. So it's easier to be able to target specific viruses that are creating issues within our communities as well. Who can get it? So it's consistent with the National Advisory Committee on Immunization. Recent recommendations that the Ontario Ministry of Health is recommended a dose of this booster, this X-ray Bravo Bravo 1.5 containing COVID mRNA vaccine for individuals in authorized age groups. So we're going to get into those age groups just now, but Typically, there's going to be a pediatric dosage for Pfizer and Moderna for the X-ray Bravo Bravo, and there will be ones for adults as well. So those 6 months of age and older who have been previously vaccinated against COVID-19, if it has been 6 months from your previous COVID-19 vaccine dose or known SARS-CoV-2 infection, those who have not been previously vaccinated can receive the X-ray Bravo Bravo containing COVID-19 vaccine anyways. I myself have been recently infected with COVID. I had a really bad hit of it. I would not get vaccinated until 90 days out. The reason for that is my titer is going to be extremely high, and I'm going to be protected as well. Me getting it, naturally, my body's going to create a stronger immune response than the vaccine. So because of that, 90 days out is when I would be, not saying approved, but is when I would look into getting the vaccine, the X-ray Bravo Bravo vaccine to help protect myself during this cold and flu season. Who can get it in terms of priority groups? We're talking about hospitals for inpatients, staff, and high-risk program outpatients, long-term care homes and elder care lodges for residents, staff, and essential caregivers. So that is us. That is our clients, our residents, and the people that we serve in our community as well. They are high risk, and based on their age as well, they are high risk. So I would strongly recommend that all organizations, agencies, which I know have already started, advertising or pushing or strongly encouraging staff and residents and patients or clients to receive the COVID-19 vaccine this year, and also receive the influenza A and B vaccine, which can also be given simultaneously with the COVID-19 vaccine. So who else can get it? I'm not going to get into this verbatim because it's quite a bit, and it's something you can read as well. It'll be also distributed to those who are participants, people in homes, long-term care homes, other congregate care living settings, pharmacies, primary care providers. These are the people who will be available and participating and giving vaccines this year as well. Individuals at high risk for influenza or COVID-19 related complications or hospitalizations. So residents and staff of congregate care living settings should get it. Again, pregnant individuals 65 years of age or greater, which is a lot of the individuals or people that we deal with in our communities. All children 6 months to 4 years of age, based on influenza risk to support co-administration. So as I've mentioned already, if you're going to get COVID vaccine, you can also simultaneously at the same time also get the influenza A and B vaccine. There are certain vaccines you can't get at the same time. I believe that is the RSV vaccine, monkeypox vaccine, and a few other vaccines you cannot get simultaneously while getting COVID. But with influenza A and B and COVID-19 vaccines or boosters, they can all be given at the same time as well. Individuals who are from a First Nation, Inuit, or Métis community as well, individuals 6 months of age, members of racialized and other equity-deserving communities, healthcare workers, and first responders should all be encouraged to receive the vaccine this year as well. Now, possible side effects. A lot of people have called or sent me messages, hey, do you have side effects? Myocarditis, pericarditis. I'm like, yes, those are some of the risks. Mind you, they are very low, but we'll get into those as well just now. So possible side effects, again, are your typical pain, redness, or swelling at the site where the shot was administered. Tiredness, headache, muscle pain, chills, fever, nausea throughout the rest of your body. But if these side effects do occur and last or linger for more than a few days, your best bet is also to call your local physician and get seen, or go to the hospital as well, because some of these side effects could get severe and serious, however rare, and may need some extra medical attention as well. Example of this would be, as I see here, an EpiPen as well for any form of anaphylactic reaction as well, which is a severe reaction. Other side effects and risks. So in recommendations for the most recent vaccine, the CDC, so we're talking about CDC Atlanta, not Health Canada, CDC Atlanta has cited a study showing that the risk of cardiac complications, which I just mentioned already, including myocarditis and inflammation of the heart muscle, in males 12 to 17 years old, was 1.8 to 5.6 times higher after a COVID infection compared to after COVID vaccination. So what they're trying to say here is, and I mean it's self-explanatory, that you getting COVID You stand anyone between those ages of 12 and 17, which was the risk group for myocarditis and pericarditis as well. You stand a higher risk of getting these side effects from getting infected rather than from getting the vaccine. So some of the studies that were done showing that the risk is much higher if you are infected. So it is still encouraging that we should get vaccinated needed for COVID. How well does it work? In December 2020, Pfizer-BioNTech phase 3 level clinical data for its original vaccine showed 95% efficacy for preventing symptomatic COVID. But we all know that this also decreases the visits to ICU and severe outcomes such as death as well. Later data on real-world effectiveness for adults showed that the protection for the mRNA 2-dose primary series waned over time, suggesting that updated vaccines would be needed to bring the immune system back to its robust level. So again, as I mentioned earlier, we've been talking about this being a yearly thing. So every year we get vaccinated, kind of like influenza A and B, and ensuring that we are protected from COVID, because COVID can cause, again, as I stated, severe outcomes. I just went through it myself. I've had every last vaccine and booster shot that I was ever been eligible for. I still got COVID. I'm high risk because I have diabetes and I have high blood pressure as well. So I had a somewhat of a not a bad outcome, but I went through some fairly bad symptoms based on my comorbidities or based on other things that are other issues that I have. So therefore, I was happy that I was vaccinated, which helped to protect me. Now, my wife, on the other hand, who was also vaccinated, she was just as bad, but a little bit worse than I was. We gave her antivirals. So there are antivirals out there that can be used, call it Pax, which is also given within 5 to, I wanted to say, oh my gosh, just stuff I usually know offhand. I'm thinking of Tamiflu, which is usually given 5 days or within 5 days of onset of symptoms. And that helps to significantly reduce any outcomes of serious outcomes or even death as well. Along the lines of Tamiflu, same objective, which is, after a few days of taking antivirals, you should be feeling a bit better. But what that helps to do is also helps to reduce the period of communicability. And if you're running into a situation where you're a facility, you're an outbreak, you start giving antivirals, the perception or the assumption is that once antivirals are given, the chances of you seeing other sporadic breakouts or other cases now diminish, and you should not be seeing anything else after the fact once it's been given. So again, that's just a little blurb on antivirals and on Pfizer as well. Now we also have Moderna, which is also an mRNA vaccine from another company. This was also introduced in December 2020. The original COVID mRNA vaccine aimed to protect against the original SARS-CoV virus. They were placed in September 22 into a bivalent. Again, as I mentioned, with the bivalent, it was protecting you against the original COVID virus and the Omicron variant, which was a BA4 and BA5, which also helped to work. But however, new updated vaccines in September of this year, 2023, replaces the bivalent shots with ones targeting just the X-ray Bravo lineage, which is 1.5 of the Omicron variant as well. Moderna uses the same mRNA technology as Pfizer and has a similar high efficacy for preventing symptomatic disease and severe outcomes. So we're talking about 95% effectiveness in preventing COVID and severe outcomes with Moderna. So just like Pfizer, it works. So one of the things I tell a lot of people is Pfizer or Moderna, it doesn't really matter. I myself have been vaccinated with both. My first couple were Pfizer, then the other couple were Moderna. And the last time I was vaccinated a little over 6 months ago was Pfizer again. So Pfizer, Moderna, doesn't really matter. They're both mRNA vaccines, and they both work as well. Now, who can get the Moderna? Again, exactly like Pfizer. The consistent with the National Advisory. NACI is the National Advisory Committee on Immunization. They recommend that Ontario Ministry of Health has recommended a dose of at least one X-ray Bravo containing COVID-19 mRNA vaccines for individuals 6 months of age or older as well. So if you've never been vaccinated, it's a good idea to start getting vaccinated, or if you have anybody who needs to be vaccinated who hasn't been vaccinated for well over 6 months, again, strongly encouraged to get them vaccinated for COVID. Either Moderna or Pfizer are the vaccines to be used. Again, who can get it? We aren't going to get into this per se, just like Pfizer. Residents and staff of congregate living settings, pregnant individuals, individuals 65 years of age and older. That's our clients, that's our residents, that's our community that we serve, community support services. So again, encourage them, as well as First Nations, Inuit, or Métis communities, and or who are self-identified as First Nations, Inuit, or Métis, and other household members. Individuals 6 months of age or older with underlying health conditions, as per NACI, National Advisory Committee on Immunization, and members of a racialized and other equity-deserving communities as well. Healthcare workers and first responders as well are in there too. So again, that's us, myself and you guys as well. Side effects are similar to Pfizer. Again, we're talking about pain, redness, swelling at the same site. And as mentioned when we're dealing with Pfizer, when I was talking about Pfizer, if you have any of these side effects and they're lingering for more than a few days, good idea to see your physician or go to ER, as this can become serious, but rare, and may need further medical attention as well, such as an EpiPen. Moderna vaccines also were going to likely associated with reported cases of heart inflammation in young adults. So just like Pfizer, myocarditis and pericarditis were some of the issues that we saw with the vaccines originally. However, as I've mentioned already, CDC has stated in a few studies that were done that your chances and likelihood of this is much higher if you are infected with COVID. So still a good idea, and it's still very encouraging to get the COVID vaccine, either Moderna or Pfizer. And again, how well does it work? Just like Pfizer, we're getting roughly 95% or better in terms of rates. With this vaccine, mRNA vaccine sends host cells in the body instructions for making a spike protein, which we talked about earlier, that will train the immune system to recognize it. The immune system will then attack the spike protein the next time it sees one, attach to the actual SARS-CoV virus, and kill it. Some people may still become infected even though they've been vaccinated, but the goal of the vaccine now is to prevent the severe disease, hospitalization, and death as well. Research has suggested that people who are infected after vaccination also are less likely to report long COVID compared to those who were not vaccinated. So, still good to get vaccinated, because if you are infected, so myself, chances of long COVID are slightly less. However, I do know people who have been vaccinated as well who do have long COVID symptoms. But this is not saying that there's no one else that's not going to get it. There's just a chance that you still can get it. Still a strong likelihood that you could get long COVID as well, even though you've been vaccinated as well. And to support this 2023-24 updated shot, Moderna shared clinical trial data that showed a strong immune response against some of the variants that are common now. So this is including the X-ray Bravo 1.5, EG5, and FL151, which are other variants which may more than likely be stronger in terms of becoming the variants of concerns or the more prevalent strains that we may see. So there is still some protection against those other variants, which tend to come out of the Omicron X-ray Bravo lineage as well. Antibody responses after vaccination were about 17 times higher against the X-ray Bravo 1.5 and about 10 times higher against the BA2.86, which is the other variant we were following, which may be the variant that may be more prevalent than the X-ray Bravo 1.5. So regardless, we're always going to have some form of protection, dependent on the strain or the variant that is prevalent in our community as well. So we also have non-mRNA protein subunit vaccines, which I'm not going to get into too much, just a basic synopsis or summary of it. This protein-based method has been used for more than 30 years in other vaccines, such as hepatitis B vaccine. The company Novavax produces the protein in moth cells, which grow more quickly than mammalian cells. Novavax is a protein adjuvant. It's a protein adjuvant. Had a 90% efficacy in its clinical trials, performing almost as well as mRNA vaccine. in their early trials as well. Similar to make then some of the other vaccines can be stored in. Okay, similar to Pfizer and Moderna, this vaccine is also stored in a refrigerator. So again, the biggest takeaway from this is it has 90% efficacy in its clinical trials. So just very close to being just as effective as Pfizer and Moderna, which are roughly 95%. So again, we have to understand that even though you are vaccinated, you still stand a very strong chance of acquiring or being infected with COVID. Now, the biggest takeaway from this is as much as you've been vaccinated, you can still get COVID. It just reduces the chances of you having a severe outcome or even death as well. The new Novavax vaccine was developed for X-ray Bravo 1.5 as well, so there is some protection. And the same one targeted by Moderna, Pfizer, updated shots as well. None of these are optimized for newer versions of the virus, including the Eris and Parula variant that became predominant in August and appear better able to escape the immune system than previous mutants. So as much as Novavax is created and does have some form of protection against the other variants, as I mentioned before, the protection won't be as strong as it would have been against the X-ray Bravo 1.5 variant, which we thought was going to be the most prevalent variant of concern this year. Again, take away from this is 90% effective in protecting trial participants age 18 and above against COVID-19, and 80% effective in preventing trial participants age 12 to 17 against COVID-19. So me reading that, I'd be like, hey, my kids are getting Pfizer and Moderna. Better protection within those age groups of 12 and 17 years of age. So what to expect? We've already gone through this. After the vaccine, we talked about likelihood of severe side effects is less than 0.5%. Most of these side effects will go away in a few days, and having side effects does not mean you have COVID-19. And as I mentioned earlier on, it was just going to be pain, fever, chills, tiredness, and headaches. And this is the exact same with Pfizer. Oh, sorry, with Pfizer. I'm tired. This is the exact same thing with Pfizer and with Moderna as well. So frequently asked questions and just some general vaccine information. Again, I apologize here. Some of the questions we do get is, I've already had COVID-19 and recovered. Do I still need to get vaccinated? Yes, you should get the vaccine due to health risks associated. There is no harm in getting the vaccine if you've already had COVID. Reinfection is common within 90 days, so you can wait until 90 days after your illness if desired. We know already, we've been dealing with this for 3 years, so a lot of us have become very good experts when it comes to infection prevention and control vaccines. We know that after you've been infected, I've mentioned this earlier, you'd have to wait 90 days, at least 3 months before going for another vaccine or for a booster. And that is also based on the fact that your titer is going to be extremely high coming off a recent infection as well. So always remember that you do not have to get vaccinated right after you've had COVID. Give yourself about 90 days. And this is all within guidance from NACI and from Health Canada as well. How long does immunity last? We're unsure exactly. You say roughly 6 months. So 6 months overall effectiveness drops to about 14%. And after about 9 months after, overall effectiveness and immunity waned further to about 9%. So further studies will unveil true immunity. We do know that as time progresses, our immunity wanes for COVID, and that is why they say roughly every 6 months we should look at getting a booster to help protect ourselves from COVID. I myself, my last booster was, I think, February of this year. I got COVID 2 weeks ago. So I probably will not get vaccinated until sometime in the new year. My immunity is very strong and very robust as well. Were the vaccines developed using fetal tissue? No vaccines are developed using fetal tissue. Some vaccines are developed using cell cultures, but current mRNA vaccines were not developed in that way. And will it cause infertility in women or men? The answer to that is no. There's no information to support that really. No reason why the vaccine would cause infertility, but there's no reason why you should not get the vaccine to help protect yourself as well. Oops. Vaccine information. So again, as per the NACI, a short interval of 3 to less than 6 months can be used to support fall program implementation institutions. For individual patients, recommended to have an interval of 6 months. However, if the healthcare provider believes that a patient would benefit from a dose between 3 and 6 months, that is also acceptable. Data from Moderna and Pfizer have shown that the Bravo 845B bivalent vaccine do not generate immune responses against the X-ray Bravo 15 variant and variants that are descendants of X-ray Bravo. Oh, sorry, they do generate. That was confusing to me because I was like, they do generate. So they do generate. So Moderna and Pfizer do show that even though you've been vaccinated against the BA.4/5 bivalent, which was the old vaccine, there is some form of immune response against the X-ray Bravo 15 variant as well, being that they are derivatives from the Omicron family too as well, or descendants of X-ray Bravo, which also comes from Omicron. The X-ray Bravo 1.5 vaccine formulation generates a stronger immune response to those or to these more recent variants. Therefore, if someone has recently received a bivalent BA.4/5 booster dose, they will continue to have protection and should not receive an additional X-ray Bravo containing dose at this time. So if you just recently vaccinated and you received the bivalent one, you haven't received the new vaccine, you're fine. And you will still have some form of protection against the X-ray Bravo variant 1.5. How much in terms of protection? Can we put this into numbers? I do not know exactly, but there is some form of protection. They're saying that you will be protected as well. There's no need to get the X-ray Bravo, which is the new monovalent vaccine at this time. Now, in terms of updates, where people can access their fall dose of X-ray Bravo containing COVID-19 vaccine. So hospitals will have vaccines starting the week of October 2nd to start vaccinating staff, inpatients, and high-risk program outpatients. Long-term care homes will have vaccine starting the week of October 2nd to start vaccinating resident staff and essential caregivers. Local participating pharmacies will start to receive the X-ray Bravo COVID-19 vaccine once more provincial vaccine supplies become available. And expected this will be later in October, so around now. Will remain on high risk. A lot of focus will remain on the high risk groups as well. The health units will continue to offer pop. So I'm not too sure what health units were. I know Simcoe, Muskoka District Health Unit, Toronto Public Health, York, Peel, and I believe Halton, which I'm not too sure, may have pop-up or will have pop-up COVID clinics. My mother-in-law is a manager in Toronto Public Health for the vaccine preventable disease with this, and she did tell me the other day that they restarted in Toronto. So Toronto does have pop-up clinics as well. It's expected that we will start offering the X-ray Bravo COVID-19 vaccine at these clinics later in October, depending on vaccine supply. And I am recommending that everyone please check your local health department's websites for any local updates as we receive vaccine. These websites will be updated and we'll let you know where to get the vaccine or where the pop-up clinics are. I know in the past, I'm talking about Toronto, because again, my mother-in-law works in Toronto. They were going to specific facilities at one time with nurses and vaccinating staff and residents. Whether or not that's being done right now, that I'm unsure about. But again, as I stated, the best thing to do is check your local health unit website to verify times, dates, and locations for vaccine. And if you're in a situation where, hey, you know what, my clients cannot get out to that, can you come over here and vaccinate them for us? And we'll have them arrive here on the days that they're doing their day programs. That might be an option as well. So you can also look into that with your local health unit. The local health units are really good. They're really trying to get people vaccinated. So they will be willing to work along with you as well, ensuring that our communities and our clients, I always say that we serve, are properly protected this year's cold and flu season. And just another encouragement again, on top of the COVID vaccine, influenza A and B vaccine would be a great one to receive, as well as the RSV vaccine for clients as well. Respiratory syncytial virus is a virus that affects us around this time of year too as well. Kind of like the cold virus. We deal with rhinovirus, RSV, we deal with influenza A and B, and no one else to deal with COVID. There is a vaccine for that. The only difference for that, though, however, is if you get your COVID vaccine today, you won't be able to get your RSV vaccine for, I think, about 14 days. Someone could probably correct me here. 14, at least until 14 days after the COVID vaccine was given. So, only vaccine you could take with COVID is influenza A and B. RSV would have to be taken at least 14 days further out from that. And that is it in terms of COVID vaccines. Is there any questions for me today? Questions or concerns?